How many of us can say, "I like the work that I do"? At the OSU Wexner Medical Center, there is a strong presence. Having that opportunity to do what you do best is how Medical Center employees stay committed to our mission of improving people's lives through innovation in research, education, and patient care. In fact, loving what you do and doing what you love is the definition of a perfect job. It's also the way Samantha Amway and Melissa Gallatin talk about their positions at OSU Sports Medicine at CarePoint Lewis Center.
I have a background in dance. I've grown up dancing my entire life and also doing gymnastics. So one of my last clinicals when I was still in school was working at the downtown clinic for Ohio State University. And we are one of the few places in the country that has a performing arts specialty. So I tried as hard as I possibly could. I was on the phone with all the managers after I graduated. How can I get into the clinic? How can I, get an opportunity to even work here?
I love running. You can ask almost anybody that if I have a free moment, I'm probably going to be outside running. So definitely endurance athletes, specifically the running athlete, are my big thing that I'm drawn to. Just it's a huge, huge passion of mine.
When you are passionate about what you do, it's a joy to share the knowledge you and your coworkers have with others. Great Wexner Medical Center managers, like Mike Martin, frequently talk with their team members about their professional growth and support staff as they grow their talents. Not only does this engage our staff, it also improves the care and services we deliver to patients.
A dance floor did not exist in our clinic, and after 2.5 years, after Mike allowing me to go out into the community and being able to show him that I actually had the population and the amount of patients to come into the clinic, he was able to purchase me a dance floor for our clinic. So that is one of the subspecialties, and it's not a large part of my caseload, but I'm working on getting it there, and that's one of our overall goals, is for me to be able to get 50% of my patient caseload to dancers.
OSU sports medicine leaders encourage staff to explore new programs that will benefit patients in reaching their performance goals.
Last year we did a running club for the Lewis Center 4-miler, which had never been done. So just things like that, just kind of, that I, before this, would probably have never even thought to do something like that. He's kind of let me, just kind of think outside the box and do things that you wouldn't think that you'd be able to.
With the freedom to pursue research and education, OSU sports medicine staff are able to advance care and help others with prevention, treatment, and rehabilitation in many diverse performance areas.
In our clinic, we have lots of different subspecialties. We have the endurance program, we have the golf program, we have different therapists who use the dry needling technique, and we all have different interests, which is what makes our clinic so special. So when we have patients that come into the clinic, once we're able to get them up on their feet and ready to go, and they're ready to jump back into whatever sport they might be interested in, we can leverage not only our own interests, but the interests of the other therapists. Because if I know another therapist has a lot of knowledge in this area, I'm gonna send that patient off to them because I want them to get the best care that they can possibly get.
Wexner Medical Center staff is here first and foremost for our patients, but they'll also tell you that loving what you do and doing what you love can improve staff engagement as well as their patients' experience.
Well, dance and gymnastics and musicians, that happens to be the part that I'm the most proud of, and it's something that's always been a part of my life. So when I'm able to incorporate it into my work, it gives me more of a sense of satisfaction and more pride in what I do. I think if you're able to harvest what your staff's strengths are, it's not only going to make you more successful as a clinic and more successful as a medical university, but it's going to give your employees more satisfaction and more happiness.
Sharing what you're passionate about, working together more effectively, and giving all staff a voice and a choice are the foundation for providing the safest and highest quality care every day.